All right, and we should be live. Hi, everyone, and welcome back to another session with DentalShadowers. We are very pleased to welcome today's guest, Dr. Farnoush, cosmetic dentist. Doc, it's a pleasure to have you here with us today. Thank you so much for taking time out of your busy schedule to meet with us. Please feel free to take it away whenever you're ready.
Great. Thank you guys for having me. I'm super excited to be here. I'm super excited to kind of share my journey, which is a little different than most with you guys. And if you guys have any questions, and I'll say it at the end too, don't hesitate to reach out to me. I had awesome people that helped me through my journey, and I hope to do that for you guys as well. So don't hesitate at all. And let's get started. So like I mentioned, I had more of a non-traditional way of getting to dental school. I took some different turns, and it kind of, looking back, I actually probably would not have done it any other way. But I didn't do the traditional high school, undergrad dental school. I had some really cool different life experiences, and really kind of fun to get to where I still wanted to go. Like I was still able to achieve my goal in the end. And I just want you guys to know that there's more than one way to get there. And so don't let it kick you back. Don't worry. Just I'll kind of go through a little bit of my journey. Hopefully that gives you a little bit more inspiration, but you can definitely, I always say it's not a matter of if, it's a matter of when. So just stay the course, and you'll get there. You'll get to whatever goal that it might be, whether it's dental school, whether you change goals, you'll still get there. So I was born and raised in Canada, and me collecting these photos was a total blast from the past. So that was very entertaining. But I'm a Quebec resident, and so I'm French Canadian. I went to undergrad at McGill University. Fun fact, I actually had the opportunity to get a music scholarship. I was a classically trained violinist, and so I turned that down, and I went to McGill as a kinesiologist. So I went into kinesiology. I minored in physiology, and we start cadaver labs in first year of kinesiology, and that was way more fun for me than, I love playing violin. I still play, I still cameo. This is a picture of me during college. I was in an oldies cover band that we used to play at some bars and stuff in Montreal. Super fun. But it's all part of the experience, right? And so I was a cheerleader. I played beach volleyball. And so again, blast from the past photos, but super fun. And I was actually on track to go to med school, and I wanted to go into cardiothoracic surgery. And I was working at the hospital in Montreal under a cardiothoracic surgeon. And so there's some life events, both personal and professional, that steered me into a way, and a little bit of a wake-up call in realizing that that's just not what I wanted. My vision of what I wanted my career to be didn't fit the mold of where cardiothoracic and medicine was at that time. And I wanted more patient interaction. I wanted more quality control over my work. I knew the aspects of things that I wanted in my career. I knew I wanted to be in healthcare. I wanted to foster relationships with patients. I loved working with my hands. Those skills you can transverse across many bounds. And so kind of finding your niche and finding what you wanted to do can take you in very different directions. And so and so that was around end of third year, beginning of fourth year. So if you think about it, I already had my medical school kind of set, and I had planned to go. And here comes beginning of fourth year, and I just pivoted and stopped and said, I don't want to do this. And that's not where I want to go. And that's not where my heart or my passion lies. And that's tough because like I said, I already had my acceptance to go, as did most of my colleagues and my friends. But now I was kind of starting back from scratch again. And I had missed the cutoffs for any kind of applications for dental school, obviously. And so what am I going to do? And that got me to, I had to study for my Canadian DATs. We had Canadian DAT exams at the time, which are pretty much the same as US, except we had an extra section called perceptual. And I tried to find if I had one of my old carving. It's a carving exercise. You get 30 minutes. You get a soapstone. It's a cylindrical soapstone. You should look it up. It's really cool and it's really fun, but it's stressful because it's soap, and so it warms up in your hands. And if it breaks, you fail. And it's a lot. Oh yeah. And so I really like that section. It's so, like I said, it's like a cylinder. It's, I think, like 16 centimeters. I want to remember that number is familiar to me. So I'm assuming that had something important to do with it. But you had to carve a shape out of the middle and on each side of that cylinder. And it had to be to the exact length or shape or depth or anything like that. Anyway, so I had to do my Canadian DATs nonetheless. So what was I going to do? I decided after graduation, I went backpacking for a couple of weeks with one of my best friends, which was super fun. So that was a nice little break. And then I applied to go to dental assisting school. And in Canada, I think some states have it too, but in Canada, it's certified. It's a certified profession, meaning you have to have a licensed, or you have to have a certificate that you went to school for it and things like that. And it's regulated. And so you can do different levels. There's level 1 and level 2, and level 2 is more advanced. So I went to a CDA level 2 course, and basically that had me doing expanded functions. My internship, which was required for you to be able to graduate, was at the Detroit Children's Hospital. So my dental assisting level 2 course was in Windsor, Ontario, and that's right across the border from Detroit. And so like I said, my internship was at the Detroit Children's Hospital, which was so cool because they have an awesome collaboration program where kids with cleft palate that are born with cleft lip or cleft palate, which means like a space, and their sutures didn't close completely. So they have like a space or gap in their lip or the top of their mouth, which is difficult for babies to nurse, right? Because they can't form a seal. They did surgery as early as 2 days old, and they followed kids up all the way till they're 21. And this collaboration board was basically a kid would come in, they'd either have the surgery, and they'd get treatment from psychologists, speech pathologists, family psychiatry. All these people and all these resources were available to them to be able to get them to function as normally as possible after having surgery and things like that. And it was just such a cool experience to have, and to see. And to see what kind of a difference you make in someone's life. And so anyway, so that was my dental assisting, and that was me up in Windsor. And then before I started assisting school, I had to take my CDATs, right? Canadian DATs. So that's what I took this summer before I started assisting school, so that I could catch the next cycle to apply for dental school. And so I applied to dental school, and then I was waitlisted at NYU. I also applied, and you'll see a trend with me is I always have a backup. And so I applied to NYU for one of my dental schools. As at the time they were accepting the Canadian DAT exam. And so I got waitlisted, like I said, and then I also applied to Harvard to do a master's in business. And like I said, I got waitlisted to NYU, but I got accepted to Harvard. And so I ended up going to Harvard to do my business master's. And remember, business and nutrition, things like that are all combined with dental, right? Dentistry is a business. It's a whole body kind of field. And so things like nutrition, which I'll talk about in a second, those all kind of come into play. So I knew I wanted to do a business master's. It just happened earlier than maybe I expected. And so I rolled with it. I went there, and in hindsight, I probably do things a little differently now. Like I said, when being waitlisted at NYU was super cool, because like, hey, I'm a Canadian and I got with it at a US school. I'm so excited, but I didn't do anything with that. And now looking back now, I probably would have been more proactive, but I just didn't know any better. And so you guys are super lucky. And I want to make sure I give you guys credit, because you have this dental shadowing platform. You have Krupa and John and all these people on here to help you guys get questions answered and give you some guidance, and have people on here that have done it and have had those experiences. And I didn't have that. I didn't have a lot of guidance. I was a first generation graduate, now a first generation dentist to refugee parents. And I just didn't have the privilege of having a lot of that exposure. And remember, this might age me, but we didn't have social media and internet back then, right? And so you didn't have as much exposure as you guys have now. So looking back, like I said, I probably would have gone to the school and asked to speak to some students and talk to the admissions director, just to say, hey, I'm interested. I want to be here. But I didn't know that. And so instead, I moved all my stuff to Cambridge in Massachusetts, and I did my business master's. And that's where I actually met my husband, who's in this photo, my now husband, not at the time. And then when I finished there, remember, I took my Canadian DATs. And when I was finishing Harvard, that's when they started, the US schools started saying they're not accepting Canadian DATs anymore. So that was awesome. Some were on the fence and some were like, oh, we might. And you call the admissions, it's like, yeah, we're still kind of accepting them, but we're weeding them out. And so it's like, okay, well, might as well just apply with it anyway, because I had it done. And so I hadn't necessarily anticipated that, obviously. And so my backup to that, in case I didn't get in that year, was I applied to the Human Nutrition program, the Institute of Human Nutrition at Columbia University. And I got into Columbia. And by the time all the admission stuff had closed and you pay your fees and all that stuff, I started getting rejection letters. And I called and asked why. They're like, oh, we don't take the Canadian DATs. I said, thanks. Why did you take my money? That's how the cookie crumbles, and that's okay. I didn't apply to a ton of schools. I think I did like 6 at that time. I mean, that's still a lot, but so it still kind of sucked either way. But then I had Columbia as my backup because I got into there. And that was such a cool experience as well. And mind you, I city hopped. You might think, oh, that's a lot of school, but it's really fun when you get to city hop, experience different cities, different programs, different schools. And, you know, I'm still friends with a lot of people from all these programs, and it's just such a cool experience. Some have gone to dental school. And so now you have like a really cool network across the country of people that you know in both medicine or dental, and everyone kind of wanted to go into healthcare, especially at Columbia. But it was such a great program, and it being a nutrition-based program, my thesis was in early childhood caries. So I was in the dental school, and I was kind of looking at other dental schools to take while I was taking, I had to retake my DAT exam. And so I retook my DAT exam. I applied to a couple more schools after I finished Columbia. My now husband had moved to Vegas when I had gone to Columbia. And so we were doing long distance, which is also fun. And he was like, hey, why don't you check out Las Vegas? And so I had talked to some of my thesis mentors at Columbia about Vegas, and they're like, oh, you get a lot of experience. We get students from that school that have a lot of experience to apply to residency. So I was like, well, that's a great reputation. So I looked more into that. And then and Vegas was actually still accepting Canadian DATs at that time. And so they had a later crossover because they were a younger school. And so when I finished Columbia, I moved to Vegas, and I actually worked at the dental research lab for part of the year, because I had to retake my DATs, my American DATs. I didn't do that well in math. I did very well in the other subjects, but I did not do that well in the math section. Not to say I wasn't smart. Clearly, I mean, all of you guys are smart. This has nothing to do with whether you're smart or not. I'll guarantee you that. You're in the top 1%. It is harder. I mean, medical and dental school is hard to get into already. I think dental school is actually much harder because you have much fewer schools. And so you have less options available to you. So it's never, are you smart enough or whatever? It's not that. It's, you know, are you able to kind of weed into that and stand out and be someone that they can see as on paper that would be a good fit for that program. And so, like I said, I was working in the dental school. And so I retook my DATs when I was working in the research lab at the dental school, which is an amazing experience. Also, I worked with dental students. I learned a ton about research, helped a lot with some research papers that was there. And the faculty were the same that were in the research lab that I was helping, and I formed really great relationships. And that's where I wanted to go. So I retook my DATs solely for the purpose of UNLV. And this is a nice strategy. So if you know where you want to go, make sure you figure out the strategy you want. So for me, I said, I'm living with my now husband, but at the time, my boyfriend in Vegas. I know I applied to some other schools, but UNLV was my number one. And so my strategy there was at that time, they were taking the top score from your DAT. Now remember, I didn't do that well in that math section. And so I retook it solely for the purpose of getting a higher score in my math, because that was a strategy. And so, and if there's anything I learned in business school, it's all about strategy. And so that's what I did, because that was my focus. And so they took my top scores, and I scored really, really well overall. and they extracted, like I said, extracted the math score, took all my other scores from my previous exams and took that into consideration. And I got into dental school there. And so that was my long-winded experience to get there. But like I said, there's more than one way to get there. And I had amazing experiences getting there. And it's not like I was not qualified, but always have a backup plan, and always you're worth it and you'll get in there. You just have to make sure you remember that it might take a round or two, and that's totally okay. And so I know this lecture today was about being a cosmetic dentist. And so when I talk about doing dental school, it's finally, yes, I made it dental school. I did it. And the answer is no. And I'll go further in that in just a minute. But, there's things outside of dentistry that you need to also do and like to do and enjoy to do so that you have more of a balanced life. It's stressful. All of this is stressful. It's not, business school wasn't easy. Columbia wasn't easy. All this takes a toll on you, and you have to make sure that you have other things that you enjoy to kind of help that balance. So working out, obviously my family here, I have 2 dogs, and happily married to my husband, who actually wanted to go to dental school way back when. He's from California. He went to UCSD and he was a biochem major, and he switched to business. And so that's always a fun fact, but I don't think we would ever have been a good match if we were both in dental school, just because of our personalities. But anyways, having family, making spend the time. I love, like I said, beach volleyball, traveling, and snowboarding are my favorite things to do out on the side. So make sure you have those things and you can enjoy yourself too along the process, along this whole journey. And so after dental school, you graduate as a general dentist, and you can do a couple things. You can specialize. So I know you've had endodontists, which are root canal specialists, oral surgeons, periodontists, which are deal with gum and bone and things like that, and do amazing things. And you can have orthodontists and pathology. You can go in academia. There's a lot of different things you can do. You can also do more advanced accreditation courses and more advanced learning in areas like cosmetic dentistry. And that's what I did. And so I had a slew of continuing education over the last couple of years. And there's postgraduate programs. There's a ton of advanced education that you should do if you want to go into more specialized treatments like cosmetic dentistry. And so that's what I did. And so that's over, I actually had to calculate it because I did an ASDA lecture earlier this year. And I was like, wow, it's like 1,500 hours of continuing education in the last 3 years. And so it's a lot, but it's when you do programs that basically like a postgraduate program, you get a lot of continuing education credits, and it's a lot of time. But it sets when you get more education, you have a better groundwork and you make better decisions as a clinician from the get-go. And so that's what I wanted, to make better, more informed, evidence-based decisions for my practice. And so, and I want to talk a little bit, like I said, what is a cosmetic dentist? So I'm a member of the Academy of Cosmetic Dentistry. I'm currently the vice chair of the Member Relations Committee of the AACD. And as a member of the AACD, you are a general dentist that is dedicated to advancing the excellence in art and science of comprehensive cosmetic dentistry. And you encourage the high standards of ethical conduct, responsible aesthetics. These might be I'll try and explain some of these as we go along, but responsible aesthetics and patient care. And so this is a case I'll kind of go through in a minute too. But your average education already is like 20 years, right? When you go through this, by the time you finish dental school. And yeah, you still have to do more. You don't know what you don't know when you get out, and there's still a lot more to be learned. And so when I see a case like this, me, or when you guys see a case like this, can you see the whole screen, or does it cut it off? You can, okay, good. Your pictures are just on the side, so I just want to make sure. So you guys probably see some nice teeth, some nice pink gum tissue. There's no like infections or anything, things like that. That's probably what you see. What I see with extra training and knowledge and things like that, you'll see different things. And so I kind of want to highlight a little bit for you. So what I see is the canine. Can you see my cursor? Okay, this is the canine. These are your centrals, right? Your central incisors. These are called your lateral incisors. And so your canines, the top of your canine, should be at approximately the same level as your centrals, okay? And it matches across, right? So canine, central, central, canine. Your laterals are about 0.5 millimeter shorter. That's ideal. And so that's what I see. So you go from what you might see, now you go to more detailed things of what I see. And I use a DSLR camera and I take a ton of intraoral photos and I see ratios. I see ratios of length to width of teeth. I see embrasure forms, the little triangle that's formed here, the way the teeth are rounded here. How this tooth is higher than this tooth. These are all little aspects I see. It's things called macro aesthetics, mini aesthetics, and micro aesthetics. There's a slew of a checklist that goes through my head to say, okay, it's not just teeth that I'm looking at. It's how the teeth are in the mouth. It's how the lips form the teeth. It's how the teeth sit in the face. And it's super, super obviously unique to each and every single person. And so that's what I'm evaluating as a cosmetic dentist. It's not just teeth, it's everything. And I'm looking at someone's profile. I'm looking at how much incisor display, like I said, that's a central incisor. So how much incisor display do they have? Oh, someone's here. How their gingival shape is, how their contour is, their emergence profile. And so I'm looking at all of these when I have a patient in my chair. And so a typical day in cosmetic dentistry, I saw the slide in there and I thought it was good. So it's similar to a general dentist for day to day. Like I said, I am a general dentist. I just focus my practice in more cosmetic dentistry. Give me 1 second. Let me turn this section on. Sorry about that. Okay, and so like I said, it's similar to a general dentist for day to day, but patients often seek out a cosmetic dentist for additional comprehensive cosmetic treatment. So like I said, it's additional education specialized in cosmetic training to see all these little minute, finite details that make up a symmetrical and ideal smile. And so I'm practicing responsible aesthetics, which means, you know, there's multiple ways to, you're not shaving down a tooth, you're trying to take down as minimal tooth as possible to minimally touch a tooth. The outside of your tooth is called enamel. And so you want to take as minimal of that off as possible in order to achieve the goal of that symmetrical smile. And so when you're doing veneers or smile makeovers or gum lifts, or you're doing neurotoxin treatment like Botox or fillers, all these things I do as a cosmetic dentist have to still be in line with all that extra education I've taken. And so oftentimes I'm replacing previous dental treatment or aged dental treatment that was done before somebody's not happy with or just needs to be redone. And so I'm doing comprehensive rehabilitative dentistry, including things in airway. And that's a whole other area. That's a whole other webinar that we can talk about because I'm an airway centered practice too. And so it's really exciting to be in cosmetic. I love cosmetic dentistry. It's a really cool area, but I still do fillings. I still do hygiene checks. I still do all these regular things. And most general dentists do some cosmetic dentistry. Some don't. You'd be surprised. Some don't like to go into that area. Some do, some venture to wherever they feel comfortable, but it's all the additional educations that specialize in cosmetic training that lets you be comfortable in what you're going to do. So I was going to take you around my office. So let's switch over. Let's switch over to this. Give me a second. Start video. I'll join audio. Okay. Can you hear me? Oh, let me see.
Yeah, we can hear you.
Perfect. Okay. You guys ready? Can you hear me?
Yeah, perfect.
Okay.
Looks good.
Oh, there we go. Okay. So, let's not stop my video. That wasn't good. There we go. I want to flip it. Perfect. So here's my office. Starting from the front door. Coming in here. I was kind of sitting in there. And so I have a bunch of different operatories. I have 5 different operatories. Hold on. Okay. Oh. Here we go. All right. And so this is my CBCT machine. And basically this is a airway. It's an orthofos, which basically means it's an advanced CBCT machine that you're able to evaluate airway too, meaning it takes like where your throat is, how your tongue sits in your throat, in your skull, and how it's a little further down and evaluates how much airway space you have also. And so we basically, when patients come in for the comprehensive exam, they get a 3-dimensional CT scan that also covers their pano, right? You take a pano on a patient that covers all that. It also takes bite wings. So people that don't have, that have a hard time taking x-rays, I could take bite wings here on them, which is super fun. And so now I have my operatory rooms. And so these are a bunch of different rooms, obviously, that we see patients in, and I'm sure you guys have seen these around. This is a sterilization room. So where everything gets cleaned or sterilized and packed up. This is my CEREC. I'm a CEREC office. We have a CEREC machine, and this is basically how you can make crowns same day, or I can scan patients and send it to a lab. I can communicate this to the lab as well. And so let me show you. Have you guys seen these before? So I just have a dummy CEREC, but basically here's my little model. Here's my scanner. It has this like funky blue light. And if you watch here, this is going to be interesting to try and do while I'm watching my, sorry. Oops, this is actually harder to do when you're watching through your phone. So you basically scan people's teeth or arches. And so this is a prepped tooth. So it's one on this side. This is a quick scan, but at least you see. Then I can basically go forward in this whole process and I build a crown to fit this tooth that I prepped. And so that's a fun thing to be able to do when you want to do same day dentistry too. And so if somebody comes in with a broken tooth, I can put a crown on the same day, because it's kind of like graphic designing, right? I create this crown here and I send it over here to my milling unit, and it mills the crown from a block like this. It's a Emax. This is called Emax. It's an Emax block. It's a lithium disilicate block. And it comes out and it looks purple. And then you put some glaze on it, and then you put it, my machines are off right now, but then you put it in this oven and it cooks it and it turns white. So, and then you can actually put it in the patient's mouth. So that's kind of that little mini tour for you. Let me get back over here to my computer. Disconnect audio. Okay, are we back?
We are, but I think your camera is off. If you don't mind turning it back on.
Yeah. Show all windows. Oh, that didn't work. I'll start video.
There we go.
There we go.
All right, looks great. Yeah, thank you for that. Gave us the full experience.
Yeah, I hope so. I was trying to come up with something. I was like, well, if you can't go into offices, you might as well be able to see everything. So anyway, so I do ortho here. I do Invisalign here. Like I said, I plan implants. I place implants here. I use those programs, like I said, sorry, the scanner that I showed you to kind of have to digitally plan my smile design cases. And so smile design cases, let's kind of go through here. There's different ways to do smile design cases. And I kind of want to show you a couple of examples too. How we're still good on time. Yeah. Okay. And so typically first thing that I see in people is oftentimes, this is actually something that's kind of common, is they have a little bit of tissue overgrowth. So if you look at the top here, remember periodontal means, periodontal tissue means gingival or gum tissue. This procedure is called a gingivectomy. Remember, ectomy is cut, right? So you're cutting the gingiva or cutting the gum. Oftentimes you'll hear this on Instagram, and I use this term all the time, a gum lift. And so this is what kind of a gum lift looks like. It's pretty quick. You use a laser. It's like a little handheld laser. I don't know if you guys have seen lasers and stuff around, right? Okay, great. And so you can also use like an electrosurge, and there's but yeah, those are, you can also do hand carving. So I've learned all those methods. I like my laser. And so I do this with the laser. The laser tends to cauterize the tissue. So even though you're cutting away, it'll help kind of stop the bleeding. So it's a little more friendly to the patient. They don't have to be, they're still numb. Apparently you can do it without them being super numb, but I've never wanted to do that. And so it's pretty quick. It takes about 30 minutes roughly. And that's including like numbing time. But the results are pretty immediate, and typically initial healing is usually within the week or two. Full healing, like if I was going to do in the case, usually is several months. So if you're doing something bigger than that, you typically sometimes want to wait depending on where the tissue is. And so think of it like your cuticle that's growing too long. You can cut it back, right? So this basically means that her tooth, she had teeth hiding underneath her gums. And so on halfway means I like taking this photo because you can see I did half her mouth and the other half I left. And so now you can see the big difference. And that's her own tooth hiding underneath there. And so it's really exciting for patients because they've gone through life with shorter teeth like that. And then you kind of open this up like this. And sometimes you're just happy with that. And sometimes you don't have to be, you don't have to veneer everything, or you don't have to do a lot of dentistry. I'd rather be more conservative, like doing this for patients, rather than having to cut all the teeth if I don't have to. But that's, again, like I said, that's with additional training. You learn how to do things to make things look better. And it doesn't necessarily mean putting porcelain veneers or anything on every single tooth. And so it's a nice tool to have in your toolbox. I was going to talk a little bit about airway as well, but we can come back to that if you guys are really interested, or we can do another webinar at some point. This is the same case that I showed you at the beginning. And so this is also one of my favorite procedures called microthin veneers. There's literally like see-through. This case, you don't even, and obviously this takes extra training to be able to do something like this, to evaluate a patient, make sure that the right patient to do this treatment on, that you'll get a good result. You have to have a really great lab that specializes in this and that knows what to do in order to get a really, really nice conservative result. And basically you'll start with something like this. This is not the same patient, but I'll show you your start. If this, over here, sorry. If this was a start patient, right? You can see what her teeth look like. Different patient than this, like I said, but in this patient, you see there's worn teeth, short teeth. And so I work with my lab. I scan the patient. I take a bunch of photos. The lab gets that. They pour a model up for me, either in stone or digitally, and then they send me back something like this. I work with them on the shape, the color, size. This is all stuff I talk with my lab with my lab, and you get an ideal tooth shape, an ideal tooth size for that person's face, and for what it. Whoops, let me see if I can put this. Nope, that won't work. Let me see. Can you kind of see that?
Yeah.
Yeah. So I'm looking at my phone's video. Can't see my video on my computer, so sorry. But yeah, it's kind of like a before, after. And this is really fun because your patient gets like a trial smile. They can see what their smile will look like before I even touch their teeth. And that's really important, whether you have a very picky patient or whether you don't, it's important that both the patient and you are on the same page. And if they're like, no, this one's a little too long, you can adjust those in this temporary phase. Because I have a mold that looks like this, that's made to this, that I can basically just fill with some material, pop it in somebody's mouth, and it just overlays their teeth with what their teeth will look like at the end. And so we can kind of fine tune everything. So we start there, and then I can get to something like this, where she had beautiful teeth. I think she, yes, there's some little imperfections, like, the canine wasn't on the same level as the centrals and things like that. But overall, she has beautiful teeth. And she finished ortho before doing this too. And so orthodontics, like braces and Invisalign, are a very important part of cosmetic practices, because it sets your teeth up in the right position so that you can be more conservative and do more responsible aesthetics. You don't have to cut as much teeth away. And so this case, like I said, is microthin veneers. So we started with the wax up. We put that on her teeth. It helped shape the tissue. Like you can see here, I did a little gingivectomy on some of her tissue too, but it helped shape the tissue and keep, after I cut the tissue away, the temporaries go on there and they help keep the tissue up there. And I didn't, aside from the anesthetic for the gingivectomy, I didn't cut her teeth. If this procedure is 100% reversible, I could take those veneers off and her natural smile, her natural teeth would be completely underneath and untouched. So it's a very fun, I like to do this, especially for patients whenever I can, especially for younger patients. It's a really nice conservative procedure. And like I said, it takes that extra training and it takes an excellent lab that you work with, but it gets really, really nice, healthy results. And so those are one of the things I really like to do, really like to specialize in here. And so, yeah, those are some of the things I do in my day as a cosmetic dentist. To kind of give you a little bit of a tour here. I want to talk a little bit of a predental checklist. Like I said, your DAT, don't be afraid to take it again, just from my experience. I mean, things may have changed a little bit now, but from my experience, don't be afraid to take it again. I mean, yes, you have to get your grades up. If you need to do some other stuff to get those grades up, that's fine. If you want to do a business degree, take the opportunity to go do it. Make sure you get your recommendations, your letters of recommendations early, but always have a backup plan. Have a backup plan, because like I said, it's not whether you're smart or not. It's just, sometimes it's luck of the draw. Sometimes where are you in that process? Are you a good fit for that school? All these things people take into consideration. So have a backup plan and do something that you're excited about to do, or that you ever wanted to do, that you're like, oh, maybe I want to look into this. Have that set up as a backup plan. There's no harm. You guys are young, like go do it. And, I've had people with second careers in my class too. And so don't be afraid to do that. It's a lot of fun. It's fun to be able to have these experiences when you can. Just a couple of things on your personal statement. When I was in dental school, I helped with the admission committee. So we interviewed students. I helped edit some personal statements and CVs and things like that. I'm happy to help any of you guys if you need it. If you need a second set of eyes on there, always happy to help that. But when we would read personal statements, the biggest thing that would come across is being honest and being genuine. I always, just a little pet peeve maybe of mine, I always laugh when somebody was like, I knew I wanted to be a dentist since I was 2 years old. I'm like, well, you don't really know what you want it to, because you don't really remember what you ate last month for dinners. And so, don't, realistically, maybe you were playing with a dental set and your mom took a picture, that's cool, but you really truthfully don't know you want to be a dentist at 2 years old. So be honest and share an experience that made you want to look into dentistry more. That's more valuable. For me, reading it when I was on those committees, it was way more valuable to be able to say, hey, this was I got my teeth knocked out when I was a kid, and I had a lot of visits with ortho. That's a more exciting story, and that's a more compelling story for me as somebody to be reading that for you when you're applying. And research your schools. Where do you thrive? Are you a cold weather person, or are you a hot weather person? Don't apply to Colorado or somewhere cold, or Alaska. I don't know. Don't go there if you hate the cold. Like, go somewhere where you'll thrive and be happy of where you are. It's more than just school. I was involved, I think, in almost every organization. I did ASDA, I did ADIA, I helped with the volunteer clinics. We had a huge veterans clinic that we offered free care for veterans. And you get involved in a lot of different things, and it's more than just school, and that makes up your entire experience. And so make sure you find a school that you want to be at. And yes, cost an issue, because that is going up, but that is not something that should stop you from going to dental school if that's where you want to go. And so I want to make sure I said that. It could be a difference of where you want to live, but if you have like 2 schools in New York, you're like, well, I don't really care where I go, and you can apply to a third school that may be a little cheaper, and you don't care where you go, you just kind of want to get it. Maybe that's a good idea. It's a strategy, and different people have different strategies, but don't let cost be something that stops you from going to dental school if that's what you want to do. look for teaching style. Like sometimes they'll let you sit in on a class. I remember I, as the president of ADEA, which is the American Dental Education Association, we did a pre-dental program where basically kids that wanted to go into dental school could come for, I think it was a 3-day kind of session, and they spent 3 days with us. They sat in, they went to clinic with us. They did 3 full days. They went to classes with us all day. Then we had hands-on for them. We did some stuff on pig jaws. It was really fun and really exciting. They really got to actually feel that out. And so find schools that maybe have that. Volunteer at the research labs. Those faculty sit on all these committees. And so it's good for you to get a foot in the door and get your face seen and take initiative if that's really where you want to be. I know some schools are starting to do some online stuff for their academic stuff. Maybe you're not an online person, maybe you're an in-person. So teaching style is important, class size, technology. Are they up with the times? Are they not? These are all things that are really important. You can always get, like I said, education after dental school, but you want a dental school that'll help you keep up with the times too. And you can network, go to local study clubs, conferences, talk to some dentists in town. The AACD has a bunch of dentists. If you need help connecting to somebody, let me know. I'm part of a bunch of different networks, have some amazing colleagues across the country, and I'm happy to help you connect with anybody if you need. And if I don't know, I'm pretty sure I know somebody that does know. So I'm happy to help you guys connect anyway. And don't hesitate to send me a DM or something. And truthfully, I'm really, like I said, I had people that helped me, and the best thing is to pay that forward. And so I'm happy to do that with intention and gratitude to all of you guys. And sorry, last thing, contact the school, ask to talk with a current student. It's not going to hurt. And so go get as much experience. And I separated those two for a reason. I put DAT and academic growth, your recommendation letters, that stuff is just has to be done. It's like one of those checklist things. Where you can really shine is the rest of it. And that's where you should really try and shine, because I've actually heard some things where they heard some little mumblings about schools thinking of taking out standardized testing. And so that's an interesting direction that people are going to. And you might think like, yay, that's awesome, I don't have to take the DATs. But, it might make it harder. That just means you maybe have to stand out more with the rest of this stuff. So just make sure you are honest in whatever you do, and do your research, and have those kind of these kind of checklists kind of roughly in your head, and have a backup plan, because it doesn't hurt. You can see from my track record, I'm still learning now, still continuing education and still learning now, but I did take a different route, and I still got to where I wanted to be. And so you guys can do the same too. A little bit of a couple of interview things, and I was kind of brainstorming on this. Google some questions, practice in the mirror. If you do end up being able to talk to a current student, ask them what their questions were. Usually, like I said, in third or fourth, usually fourth year, you were asked if you want to help volunteer to interview new students coming in. And so they probably are doing that, or you can ask for somebody that is doing that, and you can ask them what are some questions, and ask them those questions, and practice in the mirror, practice with your family, practice on your dog. Know the type of interview style. I remember I got an interview at McGill University, which is my undergrad, right? For dental school. And I didn't know that. And I was thrown for a little loop, because they did a mixed group questionnaire. And they did you read something, and then you went into a room with a bunch of people. And I thought that was super weird. And maybe I would have prepared a little different. That wasn't the school for me. It just wasn't now that, looking back, but it's interesting to know that there's different types of interview styles. And so some schools do that. They do group, or they'll do one-on-one, or they'll do a mixed group. And so know the type of interview style that school does. Definitely dress to impress. Don't show up in sweatpants. Know some key issues in dentistry. And if you don't, connect with the local dentist, or look on AACD, which is the American Academy of Cosmetic Dentistry, or AGD, or ASDA, or the ADA. Go on some websites and just kind of see what the current stuff is. You can even look in your own state and see there's dental bills, right? There's always a bill for, meaning that's how you change dental policies in your state. And so you can Google search up dental bills in your state and see what's key issues going on in your state, or your state dental society. That's another really, really good group of people to ask questions. And if you do, and make sure you have questions for each school. So, ask what is your I don't know, faculty to student ratio, or do you have time to do research, or if that's important to you. I did do a lot of research in my dental school throughout my 4 years and got published and things like that, but that was important to me. And so make sure you have questions for your school that you're going to go to. And of course, follow up. So if you do ask, and this is generally a good thing to, a good mantra to have, if you ask for business cards, and you should, if you meet anybody or they interview you, use that opportunity to send a thank you note. And I like to send handwritten thank you notes, but use the opportunity to do that because it sets you apart from everybody else. And most importantly, from all of this, know your why. Why do you want to go to dental school? Be honest and sincere and passionate in your answer. And you may be listening to me and thinking, I don't know why I wanted to go to dental school. And that's okay. Start to think about what you like about dentistry. Write it on a piece of paper. And as you kind of go through those exercises, you'll be able to figure out why you want to go into dental school. And so don't fret. I can help you out if you need to. Just reach out. And yeah, so like I said, if this is one of my favorite quotes, if you think you are too small to make a difference, try sleeping with a mosquito. And so dentistry is awesome. I love dentistry. General dentistry is awesome. I love what I'm doing in cosmetic dentistry. General dentistry is super cool because maybe I like doing cosmetic and I love doing cosmetic dentistry now, but maybe in 10 years, I want to go into something else. One of my mentors she's into sleep medicine. I have somebody else that really likes ortho, but is not an orthodontist and does amazing work. You can do anything you want. It's really, really cool. You just have to make sure you get the training and the extra training and accreditation if you want, or anything to do that. And so make sure you don't limit your tests, just test your limits and go out there and do what you do best. It's like I said, it's not a matter of being smart enough or anything like that. Sometimes it's how the cookie crumbles, and sometimes it's just where you are at that time. Sometimes it's luck of the draw, but put your best foot forward and give yourself the best shot possible. And you will get it. Like I said, it's not a matter of if, it's just a matter of when. So like I said, feel free to reach out to me. I'm happy to help you guys connect with anybody. If you do need a mentor or do you need somebody to talk to that's in your state, or that you don't know, if you're trying to go to a dental school and you don't know anybody in that state, I'm happy to see if I have somebody that I connect you with. And so thank you again for having me. This is super exciting. I really like this, and I will pass it back to you, John.
Awesome. That was incredible. Incredibly valuable. And I thought it was, absolutely empowering to hear about your sort of long, arduous journey, and for sort of illuminating the fact that growth isn't linear. So thank you for sort of echoing that sentiment. I'll go ahead and hand it off to our chat moderator, Yoon, so we can go ahead and answer a few questions from the chat. You can feel free to take it away.
So the first question that we have is your business background helpful when practicing as a dentist?
It's a really good question. And yes, because even though I am an associate, I'm looking to eventually, I want my own practice and I want to have that partnership to be a practice owner. But remember, it's still a business day to day. I treat myself working here as you have to look at it as a business owner. I'm not just coming in, clocking in and going out. I'm involved with the team. I'm involved in the success of the practice, and that's important to have. And so you don't have to be that involved or not want to, but it's a strategy. I market myself, on Instagram, on social media, and in the community here. You still market yourself because you don't want to rely on somebody else just to give you patients. You need to market yourself because I'm an important part of this team. So yeah, I think business is, if you don't maybe use it necessarily right away, you will eventually. And so it's pulling those little aspects of marketing and strategy and all this stuff into what you're doing on a daily basis.
The next question that we have is, how do you get involved in the American Academy of Cosmetic Dentistry?
Great question. How do you get involved in AAC? Well, you network and you get to know people that are there, and then you start to show initiative to try and volunteer, just like you would any other organization, right? And so you're not going to come in being like the head honcho, right? You got to work yourself up. You got to learn all the different paths and everything, and learn where you're most helpful, where your skills match where you're needed. you can go to acd.com. They have some free videos and stuff. You should definitely go there and search some of their videos that they have for you guys to watch. It's really cool. There's a lot of cosmetic dentistry focus. There's ortho videos, there's things like that. It's a great network. It's the premier group for cosmetic dentistry internationally, I would say, and we have a lot of international ACD dentists, and so it's actually accreditation and an accreditation platform too. So you can get accredited, you do cases, you get evaluated. It's not an easy journey. I'm working on my accreditation right now in cosmetic dentistry, and so it's like an extra specialization in that area. But yeah, how to get involved? You as a student, you could probably get in there and go to the conferences. You can definitely attend as students. You can have a student membership. But as a pre-dental, if you want to talk to anybody that's in your community, I would, definitely help you connect with any AAC members that are in your community, and you kind of start to volunteer and get active in that organization.
So did you have to go through extra school or studying for orthodontics since you didn't specialize in ortho?
Yes, I did. And that's a very good question, because whenever you do treatments, remember that I place implants, but I sure as heck better make sure I have all the background. Like in ortho, I better make sure I have the background, the training, the extra training, know where my limits are with things like that with ortho, with implants, because I'm held at the same standards as specialist is. And so I still work with a lot of specialists. I work with my orthodontists as well on cases, and they'll help me with cases. They're like, no, this is a great case to do with Invisalign and you should do it. And sometimes like, maybe I'd let you do this case. We work with patients all the time. I work really closely with my oral surgeons, even though I place implants. They place a lot of my implants as well. So yes, you have to take extra training for that. You don't just assume you're going to do like a 2-hour weekend course and be great at it. It's not how things work. Like I said, you're held at the same standard as a specialist. So yes, you do a lot of extra training to make sure that you can get the similar outcomes.
So what were the hours like during cosmetic dentistry residency?
What were my hours?
I think this person is just asking how you additionally studied for cosmetic dentistry.
So one of my big things, and you guys probably have access to these. Let me go back here. Sure. So after dental school, the first thing I did was the COI Center. The COI Center is a postgraduate program. It's an entire curriculum, and I finished that in about 1.5 years. And that set up extra knowledge on foundations of anything from initial things in cosmetic dentistry to full mouth restorations, ways to approach treatment that are very evidence-based and new and research backed up with research. At the same time, I was very involved with the AACD from my second year of dental school. And so the AACD, like I said, is a preeminent organization for cosmetic dentistry. And so you do training or track courses through them. And so when you attend conferences, you can do hands-on training. When you attend continuing education courses. So these are the big things. I've done a lot of smaller continuing education courses that all have to do with cosmetic training. So anything from if you split a front tooth, that central incisor, if you split that in half, how are you going to fix it? A tooth isn't one color, right? It's multiple colors. It's how it reflects in the light. And so it's learning different ways and techniques of being able to replace that with regular filling material. And it goes by tooth. Sometimes it's how to do veneers and how you take these courses in different areas that kind of all come together and give you that cosmetic training. I hope that answered that question.
It did. So the next question that we have is, could you give any tips on writing your personal statement?
Yes. So I think I mentioned over here. One thing for sure, be honest and be genuine is kind of what I put here. Think of if you get a blank piece of paper out, you can an easy exercise is to write who, what, when, where, why, right? Write all those out and answer that. So was there somebody? So who? Was there somebody that made me really excited about dentistry? And if there was somebody, put it in there. Or somebody that really influenced me. Maybe it was your mom, maybe it was your sister, maybe it was your orthodontist as a child. Where were you when you realized, hey, dentistry is pretty cool? When start filling out those questions, and that'll start helping you figure out how and what started to influence you to really want. If you don't have a specific like thing that said, oh, I want to be a dentist, or specific like a track record, or like your mom's a dentist and it's like I used to see my mom working all the time and that really inspired me to become a dentist. If you didn't have that kind of background, then like I said, write these questions down and start to fill those out and try and figure out where and when it was that things started to really inspire you to go that direction. But like I said, be honest. Don't say you like dentistry, you wanted to be a dentist since you were 8 years old, because that's just truthfully, it's not believable, right? And so be realistic and be honest. What would, if you were reading a personal statement, you would want somebody that talks about their experience. While it's important to say what inspired you to become a dentist, it's important to have other things like, I volunteered for overseas for 6 months, and that in a healthcare facility, and that really influenced me wanting to help others. Like your other life experiences should help pull the personal statement together and show other facets of, it's more than just school, right? So other facets of your life that help you be a more well-rounded person. And that's what you want to really show in your personal statement.
Those are some really good tips.
I hope so.
Yeah, I'm taking notes as we speak. So
I hope that helps.
The next question is, what was your favorite part of dental school?
Oh, that's a great question. My favorite part, honestly, so I loved clinical. Clinical was really cool. UNLV was I love my experience there. Every school has its little quirk, right? But overall, UNLV was a really awesome dental school because you got a ton of experience. It wasn't like a big NYU school where, we didn't have a lot of our graduate programs at the time. And if we did, like in my last year, I did a lot of implants. I did a lot of root canals. I did root canals for the GPR program, which is the general practice residency program, because they didn't have a large class size, and so all those cases come through to the undergraduate level when you're in there. And so you can do as much, you can kind of go and do as much or as little as you want, obviously, but the opportunity was there. And I really love that about UNLV, is you had the opportunity to get a ton of experience. And that was what was more important to me, to get as much under my belt as possible so that I could really hit the ground running when I graduated. So my favorite part of dental school. Yeah, there's some good times. I mean, the exams weren't always fun, but the people, I think the relationship that you made and the really fun experiences, like going back through photos and you're like, oh my God, I can't believe we did that. The organizations were really fun. That was really fun. And that really complemented your experience as a dental student. So I think running the veterans clinic, that was one of my top experiences that I really loved doing. We did Saturday clinics at UNLV, and Saturday clinics were basically, there was a women's clinic, there was a children's clinic, and there was a veterans clinic in 3 separate areas. And it was all student run. We took donations to be able to, and we had labs kind of donate stuff for work and crowns and things like that. And we for veterans that were making under the poverty line of income and didn't have any insurance coverage, we would do dental work. And so that was very transformational and very powerful and very exciting as a student, be able to kind of like almost run your own clinic, with your team. And I had my friends that were also part of that. And I think that was one of my most memorable experiences was doing that.
Do you have any advice for high schoolers who want to get into dentistry?
Yeah, do it. It's awesome. Go shadow. You have plenty of time as a high schooler. Go shadow. If you're lucky enough to have a dental school in your area, you should definitely go and, see what events they have, maybe volunteer, go talk to admissions counselor. They love to talk to potential students. And they love to talk to Students love to talk to potential students and kids that are just starting out. There's definitely, just go make sure you like to do it. You know, dentistry, just like any healthcare profession, it's hard if you don't like to do it. And so make sure if it is what you want to do, that you get the experience that shows you what you want to do, and that shows you that that's what you want to do. So yeah, so just go and get as much experience as you can. I know sometimes it's tough, or you could do an assisting program. In some states like Nevada, you don't have to be certified to be a dental assistant. You can start, you can help volunteer. Maybe you can volunteer with an ortho office, you know, a couple of days a week or a day a week, and just help out being assistant. So it's an assistant in the state of Nevada is an on-the-job kind of training. And so you just have to find an office that's willing to maybe have you shadow, have you help out, and you'll be able to do that. And so it's not the same in all states, but I know in Nevada it is. So if you're here, give me a shout out. You can come over to my office, or if you're in town. If not, like I said, I'm happy to connect you with someone. I don't know all the state regulations, but if you're thinking about it, the best thing you can do is go and shadow and go learn. And go learn and shadow different experiences. If you're a high school student, you think you like a dental, go to a dental office, like I said, do all that, but go to a plastic surgeon's office, go to an integrative medicine doctor's office, go do a bunch of different things. Because like I said, and you saw when I was talking earlier, I wanted to go into cardiothoracic surgery. I knew the skills I wanted, and I wanted to be, the skills I had and the things I wanted to do. I wanted to work with my hands. I wanted to be in healthcare. I wanted to build relationships. That's very broad and vague. So go get your experiences so you can see what areas of healthcare you want to be in.
I think that's all the time we have for questions today, but yeah, thank you for taking your time to answer.
Oh, you're so welcome. I was really excited to do this.
Yeah, this was fantastic. I guess on that note, we'll go ahead and conclude today's session. But Doctor, we want to thank you on behalf of our team and today's live attendees. Thank you so much for taking the time out of your schedule to share some of your professional insight and some of your experiences with us. Yeah, thank you so much again.
You guys are welcome. Bye.
Thank you.
Absolutely. Take care.